Hi, you guys. Welcome back for our daily practice questions. It is day 41, and as always, y'all know I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder that there's no absolutes in medicine, right? We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 52-year-old male patient presents with a history of shortness of breath and fatigue. Upon auscultation, you detect a systolic murmur with a grade of 2 of 6. The murmur is audible only when the stethoscope is placed slightly on the chest and is of moderate intensity. What does a grade 2 of 6 murmur typically indicate about the intensity of the murmur? Is it A, it is faint and only audible under very specific conditions? Is it B, it is audible with a stethoscope lightly placed on the chest and has a moderate intensity? It is C, it is very loud and associated with a significant heart abnormality. Or is it D, it can only be heard with the stethoscope placed firmly on the chest? Take a moment and tell me what you got in the comments, y'all. All right, y'all. So, I always recommend reading the stem of the question first, as it allows you to ensure you're answering what is even being asked of you. It allows you to slow down so you can ensure that, right? So here it states, what does a grade 2 of 6 murmur indicate typically about the intensity of the murmur? And I'm going to read that one more time. So, what does a grade 2 of 6 murmur typically indicate about the intensity of the murmur? All right. Is it that it is faint and only audible under very specific conditions? No. Is it B, it is audible with the stethoscope lightly placed on the chest and it has a moderate intensity? Yes. This B is your typical presentation of a grade 2 murmur. It's audible with the stethoscope on the chest lightly, so it's not something that's requiring firm pressure or anything to be able to identify it. But it does have a moderate intensity as far as sound goes. Question number 2. A 63-year-old female with a history of hypertension presents with chest pain and palpitations. On auscultation, you detect a murmur that is clearly audible with the stethoscope lightly on the chest and accompanied by a palpable thrill. The murmur is loud and harsh. At what grade does the thrill typically begin in the grading scale for murmurs? Is it A, grade 1 of 6, B, grade 3 of 6, C, grade 4 of 6, or D, grade 6 of 6? Take a moment and tell me what you got, y'all. Tell me what you got in the comments. All right, so similar question here states, at what grade does the thrill typically begin in the grading scale for murmurs? See, right here, the stem tells you everything you need to know. When you're thinking of the grading scale for murmurs, when do we typically note the thrill? It is C, grade 4, right? Grade 4 of 6 is when the thrill is typically noted as far as the grading scale of murmurs, okay? Grade 4. So C is your best answer. All right, and question number 3. A 70-year-old male with a history of aortic stenosis presents with severe exertional dyspnea. Upon auscultation, you hear a grade 5 of 6 murmur, which is very loud and associated with a palpable thrill. The murmur can be heard with the stethoscope slightly off the chest. Which of the following is true regarding a grade 5 of 6 murmur? Is it A, the murmur is faint and difficult to hear? Is it B, it is loud, associated with a thrill, and can be heard with the stethoscope off the chest? Is it C, it is only audible when placed firmly on the chest? Or is it D, it is associated with mild heart disease and not clinically significant? Tell me what you got. All right, so stem of the question, which of the following is true regarding a grade 5 or 6 murmur? And the best answer is B. It is loud, associated with a thrill, and can be heard with the stethoscope off the chest. So, um, just a quick note, because I'm gonna do a few of these, some more this week, just so y'all can get the hang of murmur grading. I do have a murmur grading video, but with grading, it's basically the intensity increases as the grading gets higher. So, of course, if the intensity of the sound of the murmur is louder, then less is required for the stethoscope, right? So, where you can lightly press or firmly press, or it can slightly be off the chest to completely off the chest, depends on how we increase with the murmur grade, okay? So, there's 1 through 6. I am showing you from this perspective because I feel like some of them overlap so much or is so close that it's hard to identify from that standpoint. So, one, I'm going to add the link to the video where I teach on it, but also I'm going to continue to do questions on these for the next couple of days, just so you can see what I mean from a scenario perspective. So I try to put them in a question from a scenario basis so that you can identify what I'm talking about. But also for murmur grading, one of the most key things that I want you to realize is just like what I talked about in question 2 is when the first time a palpable thrill is noted. And that is grade 4. Pay attention to that. And then it's almost like that marker um, from the first half of the grading scale of the murmur and the second half. So 1, 2, and 3, the intensity is starting to increase, but you definitely are going to have the stethoscope on the chest on those first 1 through 3 grading scales. It's just some you can have it on there lightly, etc. By the time you get to 4 and the palpable thrill is noted, now it's starting to require less pressure from the stethoscope to identify. Like grade 1, you're going to have to put firm pressure, right, to hear. Grade 4, the palpable thrill is noted. Grade 5, we still have a palpable thrill as well as in grade 6, but the sound is heard so intensely that you don't even have to have it on the chest. So like 5 is slightly off the chest, 6 you can hear it even away from the patient without your stethoscope on the chest. So again, we'll walk through that and go through those things, but I wanted you to see it from a scenario basis so that you can apply it better. So if you have specific questions, let me know. I hope that that's helpful to help you tie it together. I'm trying to design it in a way that that you're able to retain it more and not just another scale or range of things that you do. So I feel like scenario bases help more in this because you can see it, because I can't like play a sound of it or do all of those things for you to show you what I'm talking about. So giving you scenarios, I think, is the easiest way for you to understand what I'm saying and to retain it. Makes sense. Okay, but let me know if this is helping or confusing you so I can know um if I need to tweak some things. But y'all know what to do. Sorry I get on my soapbox, but just finding different ways to try to help you guys get it, and especially areas that I've known from working with review students one-on-one that I find that y'all get hung up on, or that can be confusing, or even things that used to hang me up. So I'm always processing ways to try to make it a little bit easier for y'all. But y'all know what to do. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio. You can give us a call at 803-400-6864, or shoot us a text message, or you can shoot us an email to thenursingsstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And y'all know if you're looking to book any of my one-on-one sessions or custom packages or plans, I always say either call, text, or email, because I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.